Good morning and welcome to the special edition of Inside Oakwood with Dr. Leslie Pollard. We're going to be talking about some wonderful things today, everything that you need to know about. So I want you to come on in and join us on Facebook Live at Praise 90.1 FM, WJOU. Right now we have Dr. Leslie Pollard in the studio and his special guest. Thank you for being with us today, Dr. Pollard.
Good morning, Donna. Thank you very much. It's a pleasure to be here, of course.
Yes, it is. It is a pleasure to be here. So we're going to be talking about public health, but I know you got a word before we get to that, right?
Always. Okay, so yesterday we buried, of course, Little Richard, the famous Little Richard,
Yes.
Brother Richard Penniman.
Yes.
At 87 years old, he had passed away. But I thought about his funeral and all the people who were there and present and all the grief that was poured out from around the world. And I thought about this text, blessed, Revelation chapter 14, verse 13, blessed are the dead which die in the Lord from henceforth. Yea, they, yea, saith the Spirit, they may rest from their labors, and their works do follow them.
Yes.
That expression, their works do follow them, that's a powerful promise.
Yeah.
As I thought about Richard, an image came to mind, the image of Samson. Richard was very public about his struggles,
Right,
and I
yes.
appreciated his authenticity. In each of the 4 or 5 interviews that I did, I talked about knowing him in 1978. And he was very authentic, and he was very real about his struggles. And in his struggles, we see ourselves back and forth, tortured at times, all of those things. But,
Right.
and while it may not be, I always say to people, it may not be that particular temptation, but it is a temptation. There are other temptations that each of us has. So, in Samson, though, Richard went back and forth. But the story of Samson, how he finally came to a fully surrendered life.
Yes.
And then the Bible says that more good was done in his death than even in his life.
Right, right.
And so for all of the fame and celebrity that Richard had, some of us knew that Richard had said on different occasions that very thing almost destroyed me.
Yes.
That when he was a little boy, people would ask, what do you want to be? Johnny said, I want to be a teacher. I want to be he said, I want to be famous.
Right.
As a little boy,
Yes,
I want to be famous,
Yes.
right? Okay, so he said on many occasions to many of us that thing almost destroyed him.
Right.
So he really didn't want that for his funeral. What he wanted was to be a
Right.
quiet ceremony of people that loved him and that he loved, and that's what we executed yesterday. But he did a testimony on 3ABN
Yes.
that I referred to in this week's Inside Oakwood. I would encourage everybody to listen to it because it reminded me of Samson. While many people will know about the music, the genre of his music, and all the titles, that testimony will do more good in his death
Right.
than he was able to do in his life because it will live on and on and on forever. And his fans are watching and listening and reflecting.
Right.
And so we never know how many people will be touched by the works of Richard. Many of them will go back and read that Steps to Christ book. I told one of the reporters that sometimes when he did concerts, he would hire 5 or 6 ministers, many of whom I know personally.
Really?
And their job was to distribute Steps to Christ during
To
his
everybody.
concerts. So we don't know what the harvest is going to be,
Right.
but the promise is certain. Blessed are the dead who die in the Lord. They shall rest from their labors, and their works do follow them.
Wow.
So that's what I want. I want my works to follow me. You want your works to follow you.
Yes,
As we do the good work of God.
Ooh, wow. I love that. And I did go and watch that video. I had started watching it weeks ago.
Oh, you did?
I did, but I never finished it. So yesterday, after the ceremony, I decided, okay, I'm going to go and watch the whole video.
Powerful, isn't it?
It is amazing.
And it's funny, and it's all those different things. It's humorous, it's funny.
And let me tell you, when you finish watching it, you do want to have a closer walk with the
You
Lord.
do.
It really is an appeal.
You do.
And you feel it. So I encourage everyone, as you have, to go on YouTube and find that testimony because it is powerful.
Yeah, it'll say Little Richard 3ABN.
Yes.
That's what it'll say, 3ABN.
Okay, so now we're here to talk about public health.
Amen.
Tell me about the guests that you got here today.
Oh,
We got
these are-
somebody on the phone. We
we've
got 2
got
people
great
in the
guests.
studios. Tell us about that.
We've got great guests. Let's start with ladies first. Dr. Sherine Brown-Fraser is our Oakwood professor, and she's department chair of Nutrition and Dietetics, the Dietetic Internship program, and the Master of Health program.
Okay.
So she's quite a scholar, quite a researcher, a biochemical nutritionist,
Okay.
nutritional biochemist, I should say. nutritional biochemist, and she has a lot to say. And I didn't tell her this, but I got a question for her already.
On the top.
It's coming, so she can start thinking about it.
Over there.
The whole food as medicine movement. Can we talk a little bit about that? Because we hear that a lot. And what are some of the antiviral benefits embedded in food? So we'll talk a little bit about that in the coronavirus. Then our next guest, Dr. Earl Henry, who is the chair of Allied Health. And Dr. Earl Henry is a trained public health expert as well. Okay. And one of his specialties, of course, is global health. So we're going to ask him a question, and the question we're going to ask him is about the World Health Organization. Should we or should we not pull out? What is his opinion as a person working in public health? So that's just one of the questions, and he can think about that for a little bit. And then, of course, we've got on the phone Dr. Julian Watkins, who also is an Oakwood alumnus, and all of these are graduates from Oakwood University.
Right.
The greatest university
Do we need
in the
to
world.
say more?
Do we need to say more? Do we need to say more? Look at that. We launched them into service.
Yes.
And so Oakwood University, he's a doctor, a physician of internal medicine for the New York City Department of Health and Mental Hygiene, and he is the physician in charge of the Riverside Sexual Health Clinic there in New York City. Okay. So we welcome Dr. Watkins, and his expertise is going to speak to our listeners today. Okay. We've got a great panel today as we talk about COVID and managing the health of the public, which by implication says we have to manage our own health individually.
Right. So who do you want to start with one of your questions? Where do you want to start?
Okay, so let's start with Dr. Watkins, since he's the farthest away. So Dr. Watkins.
Oh, no, let's not start with him.
Oh, okay.
I think I'll be honest, I think we dropped him.
We dropped him. Okay, but he'll be back on.
Okay, so yeah.
So let's start then with the food as medicine movement. Before we go to that, Dr. Sherine Brown-Fraser, as a nutritional biochemist, could you say a little bit about this notion? Where is it overstated? Where is it understated? And maybe too, as a biochemist, could you talk a little bit about the whole herbal movement? You know, I'm in a community, come on, say amen, somebody.
Amen.
Where people talk about herbs and golden seal and you know, black cohosh and
turmeric and
all kinds of things. And now, so I'm going to lay out my bias, everybody. So here's my bias. I'm not a physician. Here's my bias. I think all these things can be helpful in a preventative way, and I'd like Dr. Brown-Fraser to respond to it. But if there was something in carrot juice that could cure cancer, somebody would be filthy rich. Somebody would be filthy rich if there was. So I'm not saying we can't. So Dr. Brown-Fraser, respond to some of the things. Food as medicine, some of the herbal kinds of things we do, and all of us do it. We all take herbs. I'm from an African-American Caribbean family. So we do everything. We do what the doctor says, and then we do what Nanny says. What our cousins say. So Sherine, would you say a little bit about that?
I'm sorry. Wait a minute. Something's wrong because I'm not hearing her.
Can she hear us? I guess is the next question.
She obviously can hear us, but I'm not hearing her.
Can you hear me now?
There we got you. We got you.
Wonderful.
Could you hear us, Sherine?
I could hear everything.
Okay.
Yes.
Okay. Would you say a little bit about some of the craziness I just said?
Oh no. First, thank you for this opportunity. Good morning, everyone.
Good morning.
I'm very excited to be I was going to say WOCG, but JOU. I dated myself there. Food is medicine. Hippocrates, centuries ago, that statement was coined by him, that food be thy medicine and medicine be thy food, and the father of medicine in essence. And so the idea of medicine, food being medicine, is not novel, not new at all. It's something that for centuries has been a philosophy and a thought. And to your point, Dr. Pollard, there are many spectrums of that in the sense that there are those can go to different extremes, but the power is that there is power in food, and I will say plant-based food. God doesn't make mistakes.
Right.
And having my training in Boston, and I'll talk about that a little later, I found there's a lot of evidence-based data that supports the power of food as far as being preventative and curative.
Okay.
And so I want to make that full statement from the very beginning. There is no magic bullet one food that cures every. Food is a beautiful symphony, harmony that works collectively together to do powerful things internally. At the cellular level, there are foods, for example, vitamin A, which is in its original form beta-carotene, which we know comes not just from carrots, but from orange-colored foods. Vitamin A can actually enter DNA and influence transcription and translations. What that in essence means is it can actually influence how cells multiply and divide, which is why on prenatal vitamins, vitamin A has to be at low levels because it can create teratogenic effects, meaning mutations.
Wow.
So there is power in our foods, and that's just in the supplement form. You can never eat so many carrots that's going to affect your DNA. In essence, you may turn a little orange, but it's important to understand that yes, food can be medicine, which is why there's a lot of diet-drug interactions that if you are taking turmeric, or for example, taking lots of green juices, and you're on a blood thinner, it's very important to let your physician know that that I'm drinking a lot of green juices because green juices can actually interact with your blood thinners. And so this is not kind of hocus pocus or anything that's, out there that's saying that this is not working. Foods do have powerful interactions. And I believe that it's not an error and mistake. So again, to highlight, there isn't one food in essence that is a curative or cure-all, but they do interact powerfully. So foods like ginger, garlic, turmeric, golden seal, echinacea, these herbs, there's no mistake. In particular, garlic and lemon, there's actually clinical data in peer-reviewed journals, science that actually shows the antiviral, antimicrobial properties of some of these foods. So are we saying that when you eat a lemon or you eat a bulb of garlic, it's going to cure everything? No, but can it also help if you are having an antiviral occurrence? Can it actually contribute to the symphony of healing? It certainly can. And that's why I say contribute to, not a one-shot-all, but in the context of collaborative, interactive nutrients, symphony of nutrients working together.
Wow. So no magic bullets, right, Dr. Fraser?
Right.
No magic bullets, but the combination of foods working together can strengthen and fortify us.
Absolutely.
Right.
And in this environment of COVID-19, I'm getting stuff all the time. People are sending me recipes about this and that. And, so it does make sense to go ahead and take some of these because it's going to help, right?
Absolutely.
Okay.
It will not harm. I highly recommend in a time such as this, that if there was ever a time to increase your intake of fruits and vegetables, something we hear over and over again, but the power in these foods are phenomenal and how they can actually influence our cells. I know we hear it over, eat your greens, but why? Why should we eat our greens? I'll share something that's very powerful. Chlorophyll, which is within green vegetables, chlorophyll, which makes plants green, has the similar chemical structure with the exception of one nutrient in the middle as hemoglobin in blood. And this is not by mistake. Chlorophyll has a similar chemical structure to hemoglobin, which is in our blood, which is why eating green vegetables helps to support a healthy body overall, including our blood. And so that's just one additional illustration or example of how foods are powerful and can be as medicine. We're not saying that they are, again, one individual thing that will cure everything, but having them in combination on a regular basis, making sure that on your plate you see things, half of your plate being live, bright, and crunchy, kind of like to use it as a philosophy. I always encourage everyone to find 5 fruits and vegetables that you enjoy. Right. Don't force yourself to have something you don't necessarily care for, but if you can find 5 that you can incorporate for your life, 5, and that you have a steady gait with those, I think that'll do better than not consuming any at all, especially in the time now where there's a disproportionate amount of effect of
Dr. Brown-Fraser.
Sure.
Thank you very much for that. Before we ask Dr. Henry this world health question,
sure.
What's your favorite vegetable?
My favorite vegetable is kale.
Kale. Wow. Okay. All right. We're
gonna go around the room.
Yeah. What's yours?
Actually, green beans are my favorite. Yes.
Okay. What about Audrey?
Oh man, I'm here in the
background.
Actually, green beans is probably one of my favorites.
Great.
For me, it's a toss-up between tomatoes, which really is a fruit.
It's a fruit,
right?
yeah.
And broccoli.
Broccoli
is my favorite
broccoli
vegetable.
too.
Okay. You know what my favorite vegetable is?
What?
Mangoes.
Ooh! Is it a vegetable?
No, it's not a vegetable.
Okay, y'all need to stop.
No, my favorite is Brussels sprouts. Brussels sprouts.
Oh, wow.
What about Dr. Watkins? Are you on the line, Dr. Watkins?
Dr. Watkins.
Can you hear me?
Yes,
Yeah,
we can hear you. What
now.
is your favorite fruit? I mean, vegetable, we said.
Well, I like legumes, beans, and the such.
Yes.
Wonderful, wonderful.
Yeah.
And welcome, too. We're going to ask you a question about what you're doing there in New York City. But Dr. Henry, and all of these persons that we're talking to this morning, especially those who are on campus, Dr. Henry and Dr. Brown-Fraser, are instrumental in driving our Master in Public Health and Nutrition and Wellness.
Yes.
And so today we want to especially lift that up because that's an opportunity to actually learn all of these scientific and public health insights that are so important. So, Dr. Henry, you have expertise from global health and around the world. So the question becomes for you. Right now, there's a broiling, what do you call it? A roiling discussion? What's that word? You know what I'm trying to say. There's a big discussion right now about the United States and the World Health Organization. And as a person who studies global health, do you think we should pull out of the World Health? And if so, why? If not, why not? I'm not putting you on the spot, but it's
Dr.
important.
Pollard. Thank you for the question, and I want to say good morning, everyone.
Good morning.
Before I say that, we were talking about the tomato. They said that knowledge is knowing that the tomato is a fruit, but wisdom is not putting it in a fruit salad, right? So in answer to your question, the World Health Organization is a premium organization that addresses health issues as they affect the world. There are 195 member countries in the World Health Organizations, and these countries work together to address health issues, as a particular health issue might impact a particular country more so than others. The World Health Organization would help that country to address that issue. And that is how it works, right? The world has gotten smaller with the advance in traveling. People are traveling to and fro. I've been to so many different countries as most of us have been. And so because of that, the world has gotten smaller. Viruses and bacteria and other pathogens travel with us, you see?
Right.
So we have to, we impact each other as countries because we travel. And as a result of that, we need the World Health Organization. We're all in this together. As Al Jarreau sang that song, we're in this thing together. We're in this thing together. We're all in
Dr. Henry is also a vocalist, everyone.
We're in this together as member countries.
As
one country is impacted, as one person said, when America coughs, the whole world catches a cold. It's happening now with others. China coughs.
And
everyone catches a cold. So we need the World Health Organization. And so it will be foolhardy to pull out, as our president is now positioned in a posture in that we should pull away from the World Health Organization. I don't think we should. I don't think it's something that we should do. This is a time when we should band together, work together, support each other. And I think there's where we are. That's my standard.
Well, one thing the coronavirus has shown is that it doesn't really care if you're black or brown or white, or
young,
or
old,
American,
whatever.
Old, young. It just doesn't care, right?
That's right.
It just doesn't care.
That's right.
So we need to work together.
Yes.
And speaking of that, Doctor, I know I'm asking more questions than I normally would, Donna. Do you mind? You're such a good interviewer.
You are great. Go ahead.
I've learned. You've taught me well. So, Dr. Julian, in New York City now, you are at the hot spot. I mean, if there is a global epicenter of the fight against the coronavirus, it's where you are, and you are central to the front lines of that. Could you talk a little bit about what you're doing and how that fight looks for an Oakwood alumnus there on the front lines in New York City?
I work at the New York City Department of Health and Mental Hygiene. And in my life before the virus hit, I was working as the physician in charge of one of the sexual health clinics in the city. So I've kind of been fighting against one of our last big plague for the last 3 years, on the front lines. And so when all of this started, I got activated for the city's coronavirus response from the beginning of March. And it's literally been, this all-consuming thing in my life and everyone's life in the city. Throughout my activation, I've, I worked as a contact tracer really, really early in it. Like I was on the team when we got our first confirmed case in the city. We were calling and doing follow-ups and doing those contact tracings, but it soon became very evident that this thing was bigger and already out there in a way that I don't think that a lot of people had anticipated. So we quickly kind of had to transition to more so ways to try to flatten the curve, that's like a word that's been going around. Just we had to switch to other public health measures to kind of to effectively kind of dampen down the spread of this thing. And though the numbers of deaths and things that we saw in the city, those could have been exponentially higher if we hadn't done what we've done.
Wow.
I would say that currently New York City is kind of an epicenter, but new epicenters are popping up all over the world. So as global citizens and people, if we look to South America, particularly Brazil, I think keep an eye on Brazil. I think the conversation and the narrative of this thing are going to get a lot more dramatic in a little bit.
Wow.
But for New York City, we're actually transitioning to a different phase of the pandemic. We're actually starting back to contact tracing.
Okay.
We've been able to limit movement enough and get enough of the new infections down in a way that we can now kind of go back to a more precise tool of public health, which is if you test positive in the city, we are building a team of thousands of people to call you, find out who you've been around, and make sure that we can do whatever we can to help you stay home, and then talk to the people that you've been around so that they can stay home for the duration of a possible incubation period.
Wow.
Well, so are you getting back to your normal or bringing more of your regular work in internal medicine? Are you getting to work in that anymore now? Or are you still totally focused on COVID-19 patients?
I use my internal medicine training skills as a clinician a lot in this whole process. Physicians are a small part of the big public health pie, and we're all essential to this structure working. So I'm not physically seeing patients. I haven't physically seen a patient in the last 3 months.
Wow.
But the work that we do is from a population health standpoint. And so the things that I've been involved in, the efforts that I'm personally involved in, like it's more population wide. So that the actions that my team does and the things that we're doing, this is affecting the lives of hundreds, thousands of people.
So as an internal medicine doctor, you also support public health and healthy eating and all that too as well. You think, I don't know if you didn't have a chance to respond to whether these different remedies of health and eating the right things is really something that we should do. Would you like to respond to that?
I think that people should, we all kind of know exactly we know those things, right? Like eat well, exercise, sleep, try to limit your stress. But there's other parts of that too, where like you should get your vaccines, you should be going to your doctor, you should be getting your routine screenings. Those are all part of health maintenance. And it can't hurt to try to, be on top of your health and to take care of yourself, because for moments like this, if your body's in as good a shape as you can, hopefully you can fight, your body can fight off infections like this or anything else.
Wow.
So do all those things, but it's more than just what you're eating. There's a whole thing.
Right. So not like Dr. Pollard had said earlier, COVID-19 is not discriminating against anybody. So what are some of the ways that people of color can achieve healthy lifestyles to reduce their risk of contracting COVID-19?
I'll say a couple things. There's a lot of talk about like self-care and a lot of, this movement. And when people talk about people taking responsibility for themselves, you have to take care of yourself, you have to eat right, a lot of...
Oh, I think we lost him
again. We dropped for a moment. So when he comes back on, we'll pick that question up.
Yes.
But I have a question for the healthcare persons who are here this morning from the university. So in light of the COVID-19 epidemic, what are some of the unique responsibilities, Dr. Henry and Dr. Brown-Fraser, that come to you in educating future public health professionals? I would imagine this is a great time to talk about public health as a profession. It's on everybody's mind. Dr. Henry, we'll start with you first, man.
One of the things that I enjoy working at Oakwood is the fact that we emphasize public health.
Yes.
As soon as you cross that gate to enter Oakwood, you're inundated with public health messages
That's right.
and information. And so I think that is a blessing. For me, in my personal experience at Oakwood, teaching health principles and other courses, I have been blessed to be able to impart to the students and to see the students respond. For example, I talk about the benefits of eating a balanced diet, but I don't only stop there. I tell the students that you can, in fact, eat a balanced diet in the cafeteria. I would not eat in the cafeteria every day if I did not think that I can find a balance, and you can.
And you
the
can.
food provided there.
Yes.
So yes. So we impart upon our students the benefits of living a healthy lifestyle. And of course, at Oakwood, we have the standout principles.
Yes, we do.
Sunlight and temperance and adequate rest and nutrition, drink water, outdoors, physical activity, and of course, trusting God. And it's a wonderful thing to see our students embrace those principles. I refer to them as health lifestyle principles.
Amen.
And working at Oakwood, of course, has been a blessing to me in that it has helped me to not only talk the talk, but walk the talk, because we have to be good models for our students.
Yes.
And they watch you. They come into the cafeteria and they say, Dr. Salad. They call me Dr. Salad. I say, I have my salad as well, right?
Yes.
So I don't know if Dr. Brown-Fraser would like to add to that.
Yeah. Go ahead, Dr. Fraser.
No, I'd love to. And, I want to also just give a shout out. Dr. Henry's our interim program director for the Master Public Health Program. So that's his other hat. And I say that as a segue to, I think it's first important to even define public health. A lot of people, use that term very elusively. And my other background is biological science and public health. But public health is a broad term that really is the beautiful combination of science, research, and compassion. And it allows us to use big data to address big health questions, whether it's quantitative or qualitative, to look at some of the big issues that are addressed. And Oakwood is beautifully positioned with our new MPH program because we have the added feature of health disparities, which many other public health programs do not have within our institutions. The health disparities piece, which Dr. Julian Watkins, I think, was going to start addressing, is really powerful simply because COVID-19 is highly affecting, just at a high disproportionate rate, of minorities, with the Black and the Browns. And being trained with a Master of Public Health in the areas of biostatistics, and I'll read some of the core disciplines: epidemiology, environmental health sciences, health policy management, social behavior sciences. These are some of the core courses within the Master of Public Health. It will give us, the students, the platform and the tools that they're going to need, data-wise, biostatistics-wise, the resources and tools and training to be able to use evidence-based policy approaches to say, okay, look at a community. Why are we seeing, for example, New York Bed-Stuy having the highest number of COVID cases in the whole state of New York? That zip code has the highest. And these are, again, the Black and the Browns, compared to when you go another zip code away in Manhattan, you virtually see zero, not as many cases. And so looking at that as one way of anecdotally, but if you want to really go into the data and see the why, you have to be trained to be able to look at these numbers so that you can make some conclusive evidence. And this is one of the things we want to, and we can even make it local, which is why I'm so excited about the Health Action Clinic that's coming with Oakwood, and giving students real life application and to apply public health knowledge. So the MPH is a wonderful opportunity for students to really delve into the combination of science, research, and compassion, which I think is wonderfully positioned here at Oakwood University.
Okay. And Dr. Watkins, we thank you for. We're glad. We're sorry about the dropping and all those kinds of things, but we want to hear what you have to say. And you were on point one of your last question.
Right.
So, and you said there were three things that we could do. Could you continue, please?
Well, I was just talking about self-care.
Yes.
And how sometimes it's not really inclusive, and it can make people who don't have a lot of means to do the things that people promote as self-care. And I think it's just doing whatever you can within your means to try to do the best, to try to take care of yourself. But also just understanding that some people don't even have the options to get fresh food. They live in food deserts the middle of New York City where they can't find fresh food and vegetables, or they live in overcrowded conditions and don't have their heat maybe off, or they don't have electricity, or there's they'll live in a housing project next to a highway, and then they're just getting air pollution.
Wow.
So there's just so many factors that come into play, and all of it does kind of come under this public health umbrella of the maintenance of healthy life.
Dr. Watkins, in what ways, and thank you very much for those observations, in what ways did your professors at Oakwood prepare you for the service that you are delivering now to the city of New York?
I've always known that I wanted to, help people, just be involved in the medical field, but it was, right over in the biology department where I first learned about health disparities.
Yes.
And I went on a summer internship when I went to Loma Linda, and for they have like a lab for health disparities research, and that just opened my eyes to a world where there are people who are dying and who are suffering and who are having bad outcomes in their lives simply because of who they are or the situations that they face. And I haven't shut up about that since.
Awesome.
Well, thank you. You entered to learn, you departed to serve. And your dad is a very strong advocate for these policies. Julian's dad is a member of our board, Elder Calvin Watkins, the president of Southwest Region.
Right.
And he's a very strong advocate for the health outreach and all of those kinds of things as he serves on our board.
Wow. I think a lot of students might be coming in the fall thinking about studying this.
Public
huh?
health,
Yeah.
public health. And of course, at the website, we have information regarding how to access this program. We think that this is really one of the great programs that will be a benefit to the Tennessee Valley.
Yes,
A Master of Public Health in Nutrition and Wellness.
Mm-hmm.
We know what the nutrition part means, we think. What is the wellness part of that, Dr. Henry? What's the wellness part?
The wellness part has to do with lifestyle.
Okay.
Lifestyle.
Okay.
And you talk about the healthy lifestyle values, sunshine, and all the wonderful values we talk about.
Yes.
So, of course, nutrition, as we know, is the foundation to good health. But with nutrition alone, we wouldn't be able to make it. As I tell people, you can eat the most nourishing diet in the world. If you don't manage stress correctly, if you don't get enough sunlight, if you're not temperate,
Don't
or
exercise.
you don't exercise, exactly.
Wow.
It would be like a house where you build with the nice stuff all around, but the foundation, or you have
Not
a good foundation,
Right.
but everything else is not in place, then the house will fall apart, right?
Yes.
So, yes, so the wellness has to do with lifestyle. Lifestyle.
Amen.
And how that impacts the way we feel, the quality of life we live, the qualitative life. That's what public health is all about. And as we were talking about public health, there are 5 P's to public health.
All right, let's do
please.
it.
Public
All right.
health is population-based.
That's
Okay.
Population.
Okay.
And at Oakwood, we have a population, right?
Right.
Administration, faculty, staff, and our students
Right.
stand out. We're encouraging everyone to embrace stand out, these healthy lifestyle values. Then with the second P is promotion, where we promote health. We promote health by advertising health. We promote health by health education through advocacy.
That's right.
Policy, government policy. Hopefully our government will make good policies that would impact our people. And thirdly, prevention. So we promote to prevent, to prevent the onset of diseases, right? Fourthly, protection. We want to protect our community.
Yeah.
We want to protect our country, protect our country from earthquakes and typhoons and tornadoes. That's protection. And lastly, preparedness. We want to make sure that our country is prepared, well prepared. As a matter of fact, our past President Obama left a unit of preparedness, the pandemic unit, but this current president got rid of it. And so we were not prepared for the COVID-19, and now you see what's happening as a result of that. So those are the 5 Ps. And so we encourage our students to embrace those Ps, understand what they mean. And so Dr. Brown-Fraser and myself, we are focused on making sure that our students embrace these wonderful principles and that it impact their lives.
And Dr. Brown-Fraser, what would you want us to remember as we exit our program today? And we thank each of our guests, but what would you want us to remember about this topic today? What has struck you, and what is the one takeaway, if there is one, that our listeners should embrace?
Public health is the hand of Christ helping make humanity whole.
Wow. Wow. I love that.
Wow.
I love that.
Wow.
So we are his hands, we are his feet, and our task is to help make humanity whole. Is that it? Is that it?
That's it. And hi, Samantha, I promised to my 4-year-old.
She's a mom, too. Yeah, she's a mom.
I promised I'd say hello.
Little Samantha.
All righty. Well, we appreciate everybody for being with us. I think it's been a great discussion. Everybody could take a little bit away from it and be nourished by it as far as improving our life and our health and our nutrition throughout this COVID-19 environment. So thank you for being with us for Inside Oakwood, this special edition with Dr. Leslie Pollard. Thanks for being with us, Dr. Pollard, and your special guest.
Thank you, everybody.
Thank you.
We'll see you guys next time for Inside Oakwood on Monday at 8:30. Be with us. We'll have another special discussion that you won't want to miss. That's going to be Monday at 8:30 on Morning Joy.
WJ.